Complicated and confusing are two ways to describe the state of laws on abortion in Idaho. So the laws themselves are pretty straightforward. Basically, no abortions in the gem state. But the legal landscape and the overlap with federal influences can be hard to track. And we've heard for years about how uneasy that made some doctors in Idaho feel. Some have simply left the state over it to practice elsewhere. Well, in the legal history of it all, the run-on sentence gets even longer. The Trump administration made a move last week to rescind guidance on EMTALA put into practice by the Biden administration. The Emergency Medical Treatment and Labor Act, EMTALA. It's a federal law that requires hospitals receiving Medicare funding to provide emergency care, and that can include an abortion, which has been a real point of contention with Idaho's near-total abortion law. Well, the guidance from the Biden administration was accompanied by the letter you're looking at from HHS that explained that doctors are protected from violating state laws that outlaw abortion if an abortion is needed as stabilizing treatment. It's protected under EMTALA. So what does the changing of guidance mean in practice? Spoke today with Mark Herron. He's a senior counsel U.S. litigation guy at the Center for Reproductive Rights, and he explains it this way.
Rescission of the guidance doesn't actually change federal law itself. EMTALA still requires what it requires, but the point is to confuse everyone and to really sow confusion among doctors and hospitals about exactly what they can and what they are allowed to do in the face of extremely strict abortion bans.
And Mark works in legal counsel, again, for the Center of Reproductive Rights, who's no stranger to the state of Idaho. They've pursued legal actions against the gem state for years. St. Luke's Health System, also at the center of this whole thing for years, they responded to the Trump admin's action this week, saying to me in an email today, quote, "The CMS rescission of the 2022 regulatory guidance does not impact the EMTALA requirement to provide stabilizing care for anyone who presents to an emergency room seeking treatment. This includes pregnant patients. The rescission of the regulatory guidance does not change our position that the EMTALA statute preempts state law," end quote. But this is just one part of the conversation that continues, and it's a complicated web of lawsuits, legal actions, and laws on the state and federal level. This latest move from the Trump administration, it's not really a surprise. Earlier this year, the Trump team dropped a federal lawsuit that had been filed against the state of Idaho by the Biden administration, and it challenged the interaction between the near-total abortion ban and EMTALA. So when the Trump administration took over the Justice Department, when they won the White House, taking over the Oval Office, it kind of just ended that, sort of. St. Luke's Health System filed a suit back in January of this year that essentially replaced the federal suit, and that is still active. But in March, a preliminary injunction was awarded to St. Luke's that prevents the Idaho Attorney General from really impacting the total abortion ban to the extent that it conflicts with EMTALA mandated care while the lawsuit continues. The injunction in March highlights that Idaho's law, quote, allows abortion to save the woman's life, but an abortion to prevent any harm short of death is a felony, punishable by 2 to 5 years in prison. In these devastating but fortunately rare situations, Idaho law must yield to EMTALA's stabilization mandate, end quote. So did you want to complicate it even further? Let's do it. In April of this year, a district court ruled in Adkins v. Idaho that Idaho's near-total abortion ban cannot prohibit an abortion when a pregnant patient faces a, quote, non-negligible risk of dying because of a medical condition or pregnancy complication, even if death is not imminent. The judge said that doctors can legally perform abortions when their good faith medical judgment indicates a patient faces increased mortality risk without the procedure. According to the ruling, 2 key conditions must be met for the procedures to be legal in the state of Idaho. 1, the mortality risk cannot stem from potential self-harm, and doctors must use methods that maximize the possibility of fetal survival outside the womb when feasible. Idaho's Attorney General, Raul Labrador, responded to the full decision, saying his office disagreed with portions of that ruling, but that, quote, Idaho law has never required doctors to wait until a woman's death is certain or imminent before performing an abortion, end quote. It's a lot of information. It's a lot to track, a lot of different things going on. But what is the point of all of this? Well, advocates say it remains complicated and confusing to Idaho doctors who find themselves in a high-pressure situation of figuring out an emergency abortion decision.
Doctors need to continue to treat their patients the same way that they did before. And what we know now, based on Idaho law, is that they can do so. So although the effect of this is going to be to create a lot of confusion, patients should go to the hospital knowing that they should be able to receive the care that they need.
So with all the confusion, there are calls from groups like medical groups and individual doctors. They want the state of Idaho to sort of recraft the abortion laws or clarify. Idaho lawmakers, they passed on that request earlier this year during the legislative session because proponents believe that the law here in Idaho, it's clear as is. For example, Attorney General Labrador says in a statement, quote, "The court reaffirmed that physicians are not subject to criminal penalties under the Defense of Life Act when they follow the law's plain terms." He says exercising their good faith medical judgment to determine that an abortion is necessary to prevent a woman's death, even if her death is not imminent or certain. Consistent with Idaho law, the court reiterated that such care must, where feasible, use a method that offers the unborn child the best chance of survival. A lot to process there, and long story short, yeah, it's confusing for a lot of people in the legal sector, in the medical community, and of course, the general public trying to process it from the local news.